and especially coming to this country and realizing how people are detached from their food, the food that they eat, which is the central thing. It's a basic need. It's a basic need, and if we don't think about it, who are we going to be? I mean, we can't develop without a healthy workforce. We can't develop without we can even look after ourselves if we're not healthy. It's as basic as that. And when we move away from food, that's why I see all the problems that we struggle with, especially in developed countries.
If you look at how people spend their food, what fraction of their income people spend on food, in America people spend the lowest amount on food out of their entire income. We spend about between 9 to 11% on food compared to other countries where it's between 20 to 80% depending on their economic level. So food, while we complain that it is expensive, it's good to realize that we really don't spend that much on food. The problem is some of the food is really available at extremely low cost, and often those low cost foods are low quality foods also. And by low quality foods, what I mean is that they're nutritionally really low in quality. They're very high in sugars because you can buy high fructose corn syrup at very low cost in the market, so you see it in a lot of food products. And some of the foods that we see people eating it's just sad. There is a lot of prepared food coming into, people are consuming foods that are prepared away from home quite a bit. There's a lot of fast food. There's a huge amount of soda consumption. Sometimes we see 10 or 12 servings, a serving is only in 8 ounces, but we see people consuming 64 to 80 ounces of soda in a day, which is just a huge amount of calories without any other nutrient in it. What we don't see a lot of is very little of vegetables, very little of fresh vegetables being consumed, and very little fruit, and minimal dairy. If you eat healthy food, if you eat a diet that has a variety in it, eating from the different food groups, eating more fruits and vegetables, eating more whole grains, eating from low-fat dairy, and choosing low-fat or leaner cuts of meats, and eating beans and other sources of protein in your diet, your risk for chronic diseases goes down substantially. You're better able to manage your weight. And there are many barriers to eating at the level where the recommendations are. And one of the issues is related to access and availability. But we also collaborate with programs like City Fresh, where not only are we providing the education and the tools for people to stay healthy, but we are also changing the environment by which, when these two things, when education and environmental changes come together, we see the fruits of that very evident. We evaluate our nutrition education program, and last year on a small sample, what we found was that people who participated in our nutrition education sessions at City Fresh Fresh Stops doubled their consumption of fruits and vegetables. Now that's, I have been doing nutrition education for a long period of time, and I have never seen changes of that magnitude. So it's the environmental change coupled with educational change that's going to bring about the behavior change that we are all seeking.
All right, come on over. Excellent.
Emotion is an attitude, and when
be careful at the bottom.
You take a child and you push the child out the house without a meal, and that child is given a meal provided by the government, and that government meal is full of high fructose corn syrup, and that food is full of starch, and that child is asked to sit in the classroom under one of these teachers and perform off of that, something's going to happen. 3 of those 25 or 35 children are going to end up in detention because they just can't control all that sugar and all that starch. Blessing being there that they have something in their stomachs is not a balanced thing.